For 30 years, Pat Galvin was a pack-a-day smoker. Nearly 4 years ago, a medical test showed a nodule on his lung.
Right here, this small irregular nodule in the right lung.
Often, such nodules are not a worry, but Pat's history of smoking put him in a high-risk category. So, he quit smoking and began to get regular lung scans using low radiation technology at the University of Kansas Cancer Center.
This year, third year of the scan, it showed that the tumor had grown from, well, now we know it's a tumor, had grown from 8 millimeters to about 13.
We were highly suspicious that this was a low-grade, slow-growing cancer, the very kind that we're looking for that are potentially curable.
Galvin went to the University of Kansas Hospital for surgery. The growth was removed and it was confirmed the growth was cancerous. But the surgery got the entire growth, and Galvin avoided chemotherapy or radiation. The nurse navigator for lung cancer at the University of Kansas Cancer Center said the low-dose program is limited to current or former heavy smokers over the age of 55. That limits unnecessary radiation exposure as well as false positives.
We get a fair amount of smokers that would still want to be screened and, want to be diligent about their health. And it's also sometimes driven by their primary care doctor.
The radiologist who read Galvin's test and noted the growth said limiting the scans to high-risk people makes this program a reliable and safe test for finding early-stage lung cancer.
If you have a 30-pack year history of smoking and you're over the age of 55, it's likely that you're somebody who needs to be screened for lung cancer with low-dose CT.
The low-dose scans are performed at the Indian Creek campus of the University of Kansas Hospital at I-435 and Knoll in Overland Park. They are generally not covered by insurance and cost about $240. Pat Galvin, now a cancer survivor, said the scan is worth it for the high-risk population.
I personally think it's a great value and would recommend everybody doing it.
For the University of Kansas Cancer Center, I'm Jill Chadwick.